Good afternoon, everyone. Welcome to our panel discussion on the economic impact of the COVID-19 outbreak. Thank you for joining us, and include a thank you for those joining us on Zoom today. So in late December, the public health officials began sounding the alarm about the emergence of a novel coronavirus, which is now referred to as COVID-19. And in a very short time, this new respiratory disease, which was first detected in Wuhan, China, has quickly spread to other parts of the world. There are many things that we still don't know about COVID-19, including how fast and how far the virus will spread. The disease is obviously of grave concern for public health, but it is also having an impact on the global economy. There are disruptions to supply chains, there are disruptions to daily business activity, to travel, and to many people as individuals. So today's discussion is an opportunity for us to explore the complex economic challenges that are posed by COVID-19. So there are more and more articles appearing. Certainly I have been noticing them and reading them that are commenting on both the near-term economic impact and the dampening economic effects that are occurring, as well as hypothesizing about any longer-term impacts that this might have. For example, the economic slowdown in China has affected global oil demand. So I was reading last week, it's the first time in a decade or more than a decade that there's been a quarterly drop in global oil demand. So we are pleased to have a faculty panel from Hopkins Carey Business School, as well as the Bloomberg School of Public Health with us today to discuss the economic impact and to answer your questions. Before I introduce our moderator of the panel, I do want to just have a short housekeeping mention that we do have people who are joining us via Zoom, and so when we get to the question and answer part, we have help here that will come around with a microphone. So when we get to the Q&A, which Vice Dean Kevin Frick will moderate, raise your hand, give us a few seconds to get a microphone to you so that people on Zoom can hear the question. So I would like to introduce Kevin Frick, who's going to moderate the panel today, and he will introduce the three panelists. So Kevin is Professor and Vice Dean for Education here at the Carey Business School. He's a health economist, and he holds a joint appointment in the Health Policy and Management Department at the Bloomberg School of Public Health. And so please join me in welcoming Vice Dean Frick.
Thank you. As you can see from the dashboard over to your right, the scope of this condition is pretty large. Almost 72,000 cases total, over 70,500 of those in mainland China alone. At present, just 15 in the United States. And the largest concentration of cases anywhere other than China is aboard a cruise ship with 454 cases. That's probably the only condition we've ever been able to say that for. The number of deaths globally, 1,775, and the number recovered globally, 11,396. As Valerie was mentioning, there are some travel restrictions in at least one United States county over the weekend. Just to conclude putting this in perspective, declared a public health emergency in early response, although there's really no indication that the situation is all that bad in the United States at this time. I want to introduce the three panelists for this afternoon. To my left, to your right, we have Mario Montes, an associate professor and economist. He has interest in global health. In 2016, he collaborated with the United Nations Development Program to estimate the social and economic impact of Zika on Latin American and Caribbean countries. One over from Mario, we have Emilia Simeonova. Dr. Simeonova is an economist who specializes in the fields of health and health care and the economics of children's health in particular. She's an associate professor at Carey and the academic program director of the healthcare management program. In 2016, she also collaborated with the UN Development Panel to estimate the social and economic impact of Zika on Latin American and Caribbean countries. And from me to your left, we have Tolbert Nienshwa, a senior research associate in the Department of International Health at the Johns Hopkins Bloomberg School of Public Health. Prior to joining the faculty, he was Deputy Minister of Health in Liberia, chaired the Incident Management System, managed a multinational team responding to the world's largest unprecedented Ebola outbreak in 2014 to 2016, and he's a member of the Global Health Index International Panel of Experts, which assesses the overall health of nations globally based on a myriad of health indicators. So we have quite a esteemed panel this afternoon. And the first question is sort of just an opening question, just to make sure we're all on the same page of what we mean when we talk about measuring the economic impact. And so especially with your experience, Mario and Emilia, do you want to give a comment on what it means to measure the economic impact of a disease? And make sure to turn your microphone on.
Sure. Thank you, Kevin. I'm happy to start. Broadly speaking, there are sort of three main categories of costs that arise as a consequence of diseases or outbreaks or epidemics. There are costs that derive from disease-associated medical costs or lost productivity by individuals who are directly affected by the disease due to increased morbidity, mortality from the disease. So that's one broad category of costs. And then you have costs that originate from just reduced economic activity in the regions or countries directly affected by the disease. And a third of things like reduced tourism or reduced consumption more broadly. And a third category of costs, which happens to be particularly large and worrisome this time around, consists of costs due to the fact that economies are more and more integrated and linked with one another. And so you've got, for example, the role that China plays in global supply chains means that countries other than China are being affected by the disease. So these are three broad categories, and we can talk about more specifically about the estimated or projected economic costs coming from each of these three categories.
If I may add, we use costs, and all these three sources of costs are also, possibly with the exception of the last one, we use that also to estimate the burden of chronic disease, which is a very different case than what we have here, which is an epidemic and a very highly infectious disease. Chronic disease also has immediate costs, the reduced productivity, also the burden of excess mortality and so on. I think everything here is magnified to an exponent simply because there is so much added uncertainty about who is going to get it, how it's going to travel. We don't really know much about it. So that's sort of a particularly acute case in this case, and we'll talk about some other epidemics from before to compare this with. And to add to Mario's great characterization, we can also add another axis to this, which is the time. Over time, these costs, some of them are very immediate. Some costs are protracted and sort of go on over the medium term, 2 to 3 to 5 years. And then there's some costs that we will discuss a little later also, we may be incurring even 20, 30, 50 years from now, depending on what we learn about the virus in the long run.
Anything to add, Tolbert?
So my colleague have given an insight on how you measure the cost, the direct and indirect costs of measuring the economic loss. If you put it into context, from leading the West African Ebola outbreak of 2014, 2016, you will note that the three countries alone, Guinea, Liberia, and Sierra Leone, had about 2.2 billion of their GDP in terms of direct costs in loss. And then you put the indirect costs of the social burden that cost the population of those three countries most affected of the Ebola outbreak. And then you look at the global impact, it had because of the international spread of the disease and the disability life lost of over 11,000 population of the three countries. In my country, Liberia alone, we lost about 4,800 people from the disease and 11,000 others got affected. And if you look at trade, that was affected, commerce and trade, revenue lost. Up to today, a country like Liberia, low, middle income, developing country, the three countries with health system challenge. And the cost of the number of people that died, the GDP of Liberia was almost reaching to double digit of 8%. And then when Ebola struck, we saw below 0% GDP. Up to today, the three countries have not recovered from the scourge of the outbreak of those of the Ebola outbreak. So the direct costs and indirect costs are those measures that you look at. Treatment costs, costs to the health system, all fabric of the health facilities and economic growth of those countries are affected. We're seeing it right now about the statistics that you just heard about China, but we'll give you more details as we go on.
Great, thank you. So that your answer actually leads into the next question, which is really thinking about how this compares with any of the other conditions we've seen, starting with SARS, including MERS, H1N1, Zika, and Ebola. Do we have any idea how this will compare with those in the past? And why don't you take that one first, Talbert?
There is his comparison for one fact, looking at the public health and the political measures that are taken right now, you can note that, or you can appreciate that instead of even dealing with the impact of the disease itself, the measures, some coercive measures and quarantine huge population, the worst quarantine of population that have ever taken place is the coronavirus disease that we're dealing with right now. Over 50 to 60 million people quarantined in China. And you look at countries closing their borders, airlines, and all of that. So we're talking about one of my colleagues, Jennifer Nuzo, who worked for the Global Health Security for Johns Hopkins, were even estimating about 200 billion for the Chinese situation that we are faced with right now, about trade, investment in the infrastructure, hospitality industry, and all of that. We saw similar thing with the SARS and the similar thing with the MERS in Southeast Asia, and all of that, the economic loss that is placed as billions and billions of dollars.
Thank you. Mario?
Yeah, so when you look back at what happened in 2003 during SARS, you see, you can look at China, you see GDP growth falling substantially by sort of 2 percentage points in the second quarter of 2003 compared to the previous quarter. But then as soon as the outbreak sort of got under control and started to sort of slow down, we saw a recovery. So GDP growth went back, sort of there was a rebound and went back along its previous sort of, long-term path. And the reason is that sort of the fundamentals of, what drives economic growth had not changed. So when I look at how most economics advisory firms are looking at trying to estimate or predict the impact of this coronavirus, I see a very similar sort of trend in that like Morgan Stanley or Oxford Economics and other economics advisory firms are predicting that GDP growth will slow down right now in the first quarter of 2020 between 0.5 and 2 percentage points. But then as long as the peak of the epidemic is now February or March, then the prediction is that there will be a rebound in the second, third, and fourth quarter. In part, this will make up for some of the lost economic activity, but although not entirely. And so most predictions are that the Chinese GDP growth will drop by 0.5, 0.6 percentage points this year. But again, this is all subject to the assumption that the epidemic, the outbreak in China will be limited in time and contained and sort of stopped quickly, similar to or faster than what happened in 2003. Of course, there are big differences between SARS and the coronavirus. As far as I understand, the coronavirus seems to be more contagious, according to the uncertain and still developing information. Even though it seems to, for a large proportion of patients, the condition is mild. 80% of patients seem to have mild symptoms from the coronavirus, as opposed to SARS, which was a little less contagious, but a lot more severe for the patients who did contract it. There are also differences, because in 2003, China was a much smaller part of the global economy compared to today, 16% of global GDP, the second economy, the main exporter in the world, which means that the economic consequences beyond China are likely to be larger today.
Thank you. I want to come back to that in a minute, but Emilia, anything that you'd like to add about just the general impact?
Yeah, so first I agree with Mario that most of us believe that since there's no big change in the fundamentals of the economic fundamentals, it's probably going to be just a temporary dip, and then the economy will catch up, and there won't be a big major impact on the global economy as long as we are getting to the peak right now and it's contained. The important thing to emphasize here is the difference in the transmission rate, which Mario got at, and SARS and MERS seem to have much lower transmission rates than the coronavirus at this point. And probably the closest thing that we can compare it to is probably the Spanish flu, which happened in the early 20th century. And there were very few containment efforts, if any, until it really got out of control. And I invite you, it was way back when, but some of us have read the research on the impacts of the Spanish flu. It had a really, really long-term and very bad impact on the immediate and medium-term and long-term outcomes of economies and health outcomes. So, the containment efforts have been successful relative to the Spanish flu, but I would think of that as the counterfactual to what could happen if we fail to contain the coronavirus in the way that it's acting right now, from the little that we know about it.
Thank you. So Mario, you mentioned, among other things, the impact on countries other than China. And so is there anything you can elaborate on that, particularly with respect to supply chain issues that we may not have seen in other events of the past 2 decades?
Yes. So countries other than China are affected by factory closures in China because many manufacturers in the US, in Europe, in the rest of the world outside of China rely on components from China, on capital goods from China. And so disruptions in factories in China mean that U.S. companies don't have intermediate inputs that are necessary for them to produce final goods and sell their final goods. In addition to China hosting a number of factories from international companies directly, which is sort of a direct effect on non-Chinese economies. The news that from the past few weeks are not good. Many car manufacturers, electronics manufacturers have reported that delays in those supplies of intermediate products. For example, Hyundai announced suspending production in South Korea due to lack of parts from China. Kia also reduced production in South Korea. Nissan closed a factory in Japan, a factory that relies on components coming from China. European car makers are also reporting, delays in disruptions of production in Europe. Tesla also mentioned delivery delays. Foxconn, that produces components for our iPhones and iPads, have also announced delays. So there are. The effects are being felt right now around the world. Another industry that, as health economists, we pay close attention to is the pharmaceutical industry. And China accounts for a very large proportion of pharmaceutical products consumed in the U.S. Proportions that are between 70 and 80 something +%. So it's potentially the disruptions in China might affect vital, important industries in the U.S. and elsewhere.
Thank you. Emilia, I want to ask a different question for you. Thinking about one thing that I heard over the weekend, I read it was called the biggest work-from-home experiment ever. Think about the impact on labor and how people are going to work, and could this actually lead to innovation, or is this just something that we're going to have to deal with?
That's a good question. I think it depends because I think some types of jobs you can work from home, and you'll be perfectly fine. So this will be a case for employers to just realize that it's okay. We can have our workers work from home and nothing major is going to happen. I mean, one of the industries that comes to mind is, for example, software engineers or server administrators and so on. They can do it from home. They can do it from the office. And a lot of people who do mostly intellectual work at the computer don't really necessarily have to be in the office. So this is an opportunity for employers to realize that that's fine. We will let people work from home and let's see how it goes. And given that everybody says that they're just super bored and they don't know what to do with themselves, maybe they just are more productive. They spend more time doing their work because that just distracts them from the craziness of everything else that's going on. On the other hand, Mario just went on and on about the supply chain disruption. People who have to be in factories and put things together obviously are not going to be productive staying at home. So there will be disproportionately bad negative impacts on those industries as opposed to, for example, if you do your server maintenance out of China, or if you rely on some software packages that are developed in China, or any of the mobile tech industry and so on. So for anyone who actually has to be on the factory floor, this is obviously not going to work. But for those who are engaged in more intellectual computer related where you don't have to be in a place to put things together, we may see much more work from home once employers realize that this is actually working for them. Another thing that actually to add to Mario's comments is I think the tourism industry is going to be really impacted by this. And not just people going to China, and we've all heard about the cruise industry, but also China has a lot of people travel out of China. They travel all over the world. And if you read the European news, the Europeans are feeling it because they just lost their biggest group of tourists. I mean, they all love having the Chinese tourists come, and it's kind of empty around the Eiffel Tower and around, because some countries have travel restrictions, but some people just don't want to travel because they feel insecure. They just sort of sit in place even if they're not under active quarantine. So the travel industry, the tourism industry outside of China is going to take a big hit from this.
Thank you. I want to turn to Tolbert next. Thinking about the frequency of conditions like this, I mentioned in the opening comments, starting with SARS. And, starting with SARS, this is probably the fifth or sixth one like this, with a global public health emergency. And I don't remember how many years before SARS the last one was. So do we think that this type of event is going to come with increasing frequency in the future?
Thank you. It's a great one. We're faced with a very, very peculiar situation and difficulties at this time of our global interaction. The interaction between animal, humans, and the environment, especially animals and humans, is getting more closer than ever before due to climate change, deforestation, and other issues that affect the environment. So some of these zoonotic diseases from animals that affect humans are the OIE, which is a sister organization to the WHO, was the statistics and evidence that 65 to 75% of infectious diseases that affect human are from animals. And so Ebola taught us lessons, indication from bats. We saw the lessons from SARS. We saw Lassa fever. We've seen the MERS and coronavirus. All of these have an origin from the animal population. And this is why the One Health approach to dealing with outbreaks is very, very much important. Not only when it springs out in the human population and it starts human to human transmission, we get concerned, but we need to monitor what's happening in the animal population, because a lot of these diseases, we are acquiring them from the animal population. And right now, we're seeing the frequent outbreaks of the diseases from animals. WHO, as you just said, has declared public health emergency in the last decade than ever before, with the Zika virus, with Ebola, with the coronavirus that we're dealing with right now. So the situation is something that will be more frequent. We should get prepared for more emerging diseases and re-emerging diseases that will affect the human population. And as public health people, this is where triangulating and looking at the frequency of these outbreaks and what caused them and studying it very carefully. When it is in a human population, this is where it even get more critical. People are worried, countries are worried right now. But my thing is, we should allay the fear. Isolating the population, putting in place all of the quarantine measures, canceling conferences, and deterring the population from moving instead of focusing dealing with the disease is something, for me as a public health expert, I would recommend more to our countries and political leaders, that we should focus on the disease and what is taking place in the human population with the disease than putting in all of these measures. The coronavirus disease outbreak started sometime in December, as we learned, as evidence have shown. We in almost February right now. All of the measures with quarantine, with creating fear, stopping people from traveling, is not stopping the disease. So going into China, understanding the situation there, looking at the epidemiology of the disease, the mode of transmission of the disease, knowing the data is very, very much important. For us to put the disease under control is for you to follow all of the infected people, their contacts, the last case of the contact, and following the disease very closely is how we get to the bottom of it. So China needs to also open up so that the rest of the world can go in there and understand the disease. When I was dealing with the Ebola crisis in Liberia, we did not know the situation, how to deal with it, until we got the evidence. And the data spoke to us about the number of people that were affected, where they were affected, how do you get to them, how do you trace the last contact, how do you put people into isolation. That's how we got to the 42 incubation periods that got Liberia Ebola disease clear, and then we moved to the rest of the other countries in the region. That's how we got rid of the disease. And the United States government played a pivotal role of moving in there with logistics and manpower and the resources to get West Africa free of Ebola. China needs the same at this stage.
That's very helpful. I think one of the things that this illustrates, given the increasing frequency, is it's tougher for either governments or businesses to plan long-term when they think, what is it going to be like 5 years? Am I going to have another event like this 5 years from now? Any thoughts on what either governments or businesses might be able to do to plan better with this much uncertainty? You want to start, Talbert, if you want to think about the government side?
I think that is already happening with the United States government creating the Global Health Security Agenda as a flagship program. I think that needs to boost up the work that the U.S. CDC is doing across the world. Our work with the U.S. CDC to set up the National Public Health Institute in Liberia, and the African continent have about 15 public health institutes now. Egypt had a first case of the coronavirus, the only country on the African continent, and they were able to move quickly to test the case, isolate the patient, and following up the contacts right now. So the capacity of creating this kind of model, like the US CDC across the world, disease, any part of the world, we're talking about China right now, a province in China that is getting the whole world panicking. So disease in any one part of the world, no capital city is safe. So making the measures in place and putting in the resources to contain it at the origin is the way to go.
Thank you. My colleagues from Carey.
Thinking about sort of business considerations. So I, as Professor Saslow mentioned earlier, we're all reading articles, and I was reading an article last week or 2 weeks ago. I read an article that came out in Asia Times, and this article sort of made this point that there seems to be a lot of room for modernizing, a need for modernizing the agro-business system and sector in China. And the article made a comparison between the Chinese, dairy products sector and a case in Italy, the case of a Parmesan cheese, that I thought was really interesting, and I'll sort of illustrate it briefly. So with Parmesan cheese, pretty, it's a $2-3 billion business, a year business, a big business. There are about 700-800 milk suppliers in a consortium in northern Italy. There are very stringent quality controls with random checks. These suppliers are large. Like the smallest have several hundred cows. The biggest have a few thousand cows. So a small set of suppliers, random checks on the quality of the milk, and very severe punishment for suppliers that do not meet those quality requirements. And then sort of, the article went on to compare with the situation in China, where you have tens of thousands of suppliers. Most of them are really, really small. There's intermediaries between the suppliers and the dairy product manufacturers, so it's much harder to control quality. And so, again, there seems to be a lot of room for business improvements and modernization of that sector in China. So there's food for thought for us, business school, faculty and students.
Thank you. And Emilia, before you answer, just one thing to tie in on the uncertainty. You'd mentioned in one of your earlier comments about the long-term consequences. So if you want to tie that in and think about what we do or don't know about long-term consequences, particularly in comparison with some of the other conditions over the past couple decades, that would be very useful.
Yeah, thanks, Kevin. I'm going to address that to add to Mario's answer. I think it's very important, I think, given that there is a lot of animal to human transmission lately, as Tolbert was referring to, it's very important to regulate and do random checks in any place where there is wild animal markets, for example. And it's not only in China, it's all over the world. People sell these things. Sometimes it's illegal, sometimes it's legal. The more we clamp down on this, the less poaching is going to happen, and the more we will be able to control, or at least to know what is going on. Some of these things might have to be shut down completely because they've been sources of outbreaks in the past. And the other thing is that I think we are hearing a lot more about these. They seem to be more and more frequent, both because there's more contact between humans and animals, also because probably there's something going on with climate change, but also because there's much more information that is being shared and we understand more about these conditions. So, Ebola seems to have been on and off in West Africa in the past as well, at least from what I remember reading in the when the crisis happened. We don't know if some of these haven't been around. For example, I read an article by Chinese scientists saying they tested a lot of people who they were tested bat caves in Wuhan and that Hubei province, and they saw that very similar virus in bats that's been living there for a very long time. They tested the population that lives around these caves, and they realized that 2 to 3% of those people were resistant to the virus, which means they may have been infected either as children or as grown-ups at some point. Nobody ever realized that this was coronavirus or a cousin of the coronavirus, but these people survived, and now they are resistant to the virus. So there's a lot of that. The more we know, the more we share about the research, as Tolbert was saying, the better we will understand, and probably the panic will be much more rare in cases where these things come up. The more often they come up, we'll be better prepared. For the long-term consequences, I did compare this to the Spanish flu, even though we know very little about how it works. But one thing we need to be to always consider is that these things, there's the immediate impact, as Mario referred to, the immediate costs, medical costs of containment, but also treatment and so on. But we don't know if there are some long-term costs, like, for example, long-term conditions that are associated with having had this disease. So Ebola was thought to be, you're done with it once you've recovered. If you're lucky enough to recover, you're done with it. But then there was the case of the American doctor who had Ebola, and then, a few years after that, they were studying him, and he still had some issues that they could trace back to Ebola that may lead to long-term disability. So there's the long-term disability possibility for people who have been exposed, and we don't know that because we don't have that data yet. Like things like pulmonary conditions, propensity for asthma and frequent respiratory infections is the first thing that comes to mind. But also in cases like SARS, in cases like coronavirus and the flu and Spanish flu, pregnant women are particularly susceptible to upper respiratory disease infections. And so when they get infected, the disease has a different course, and the question is whether it passes through to the fetus or affects the fetus in any way. Nobody really thought, some people suspected this may be the case for the flu, and the Spanish flu in particular. We have a lot of big literature at this point that says that yes, that was the case. So the people who were in utero when they were affected, their mothers were affected by the Spanish flu, 30, 40, 50 years later, report higher rates of disability, higher rates of mortality from chronic diseases, inability to work, early disability, and so on. So these kinds of things, we don't think about them when we're dealing with the immediate impact of the disease, but unless it's something like Zika, which exactly was the problem with Zika was you don't die from it, but if you're pregnant, then the child has really, really strong probabilities of having a lot of complications. We don't think about that. So it's important to follow up, it's important to keep up with the data, and it's important to study people over time, because the epidemic will have both an immediate impact through the medical pathway, but also being under quarantine, being under stress because you don't know if you will get this or you don't get it, in particular for vulnerable populations like pregnant women, may have long-term consequences for the next generation. So it doesn't stop when we've contained the epidemic. It may continue for a while, and it's important to keep track of that too.
Thank you. Well, we've had some great insight from our panelists on questions about the impact, how we measure it, some of the causes of uncertainty, and how we might deal with some of that uncertainty in the short and the long term. I want to give our audience members a chance to ask questions. Certainly people here can ask questions, and anyone listening on Zoom can type questions in, and we'll make sure that they get asked. Dalton, the first question.
Yes, thank you. When SARS impacted about 8,000 worldwide and killed close to about 1,000, it was characterized as a pandemic. I'm yet to hear COVID-19 characterized as a pandemic. And I would ask you if you can also comment on the influence of the WHO, given its relationship with China. Are they doing everything possible to assure that a vigorous response is being given to this virus as they did with SARS?
Tober, you want to comment on that to begin with?
Thank you. The characterization of the disease is based on the magnitude of international spread and the number of people affected and all of that in terms of deaths. If you see the coronavirus disease and what is going on right now, most of the deaths are based in China. So they are not like spread of and more people die in the international war to make it a pandemic of global. But it's an international concern, and this is why WHO declared the public health emergency of international concern, so that countries can get prepared, so that developing countries that don't have the resources can get resources and get prepared. With the other question was that influencer. One of the thank you. One of the things that WHO is working on right now at the highest level is to put an international team together to move into China to understand the magnitude of the disease. You know, this is a new coronavirus disease that we're dealing with. So there's not enough information on a lot of other things, that the number of cases, transmission, how virulent the disease is. And so all of these started going on. Right now, there is no known treatment for it. We don't have vaccines for the disease. That's how Ebola started. When Ebola started, we didn't know much about Ebola. My colleague was telling you about the long-term consequences of the disease. We have Ebola survivors who have a lot of health issues. We didn't have vaccine for Ebola, but during the time of the emergency, working with the National Institute of Health and Allergic Infection, we were able to develop a vaccine now for Ebola. So there are vaccines in production right now for the coronavirus in China. And so China and WHO are working very, very closely together. And you're correct, a lot of resources were coming from China to WHO. These are some of the economic impact.
Thank you. Anything to add? Okay. Nida, go right
Hi,
ahead.
I'm Nida. I'm in second year of MBA and I'm from Pakistan. This issue is very much of concern to me because I am from an underdeveloped country and I know how bad it can get when it comes to an underdeveloped country. We don't have good healthcare resources, and my country doesn't have a quarantine facility to begin with. That's why we're not calling back our citizens from China, because we know if it comes to our country, it will be disastrous, you know. And we have seen like diseases spreading in Africa and like other underdeveloped countries. A lot of people die because of it, you know. And I really don't think WHO is doing enough right now. And they have not reached out to us yet. And Japan and China were the first countries who started distributing testing kits to us. And I feel like other developed countries could care more, and they're not doing enough, because I have been talking to a lot of people here. And like all this talk about economic impact, all the three costs that you described, Mario, the cost of productivity and consumption, integration of economies. And Tolbert mentioned that human cost is the direct cost. That is where we should begin with. You know, I don't see how it's incorporated in the economic cost, or its weightage should be very high in comparison to the other indirect costs. I don't. So, for example, like when the HIV spread in Africa, there was not a direct economic impact on the country out there, but 10 million people died, and all these companies like Pfizer and GSK had the treatment for it, and they were fighting to protect the parents for it because they wanted economic returns, you know. So as a result, a lot of people died who could have been saved in time. So is it about economic impact, or is it more about a human cost, you know? People are dying because of it, and I don't see the developed countries caring enough. They talk about humanity and all these things, but I don't see that reflecting in their action. Like nobody reached out to 3M or other companies like this to like start producing the mask more, or other, you know, there's no pressure on these. Like these are privileged people. We're not. We don't have research facilities. We cannot do enough. But these people can do a lot, you know. And I don't see enough response from them. They turn very insensitive. They tell me that it's not impacting US right now, so we don't want to talk about it, and let's talk about things that we have control over, you know. So it's very crazy, you know, like especially like people in business education. I feel like they don't care about the impact that their decisions are going to have. And these are the same people who are going to end up in big pharmaceutical companies, and they're going to repeat the decision that we call as unethical when we discuss these in these cases, you know. And I'm sure it's going to keep happening. So I don't know where it stops, How can we stop it?
So trying to focus on the difference or the importance of both the economic and the human costs.
It's absolutely, we've been focusing on the economic cost of this outbreak in this panel, because it was sort of the focus of the panel, but that doesn't mean that, human costs are not sort of, front and center. I mean, there are 70,000+ people infected, 1,800 people died. Those are big costs. We are seeing already, like you said, some issues with the supply of certain types of, medical equipment, masks, and other gowns and other equipment. I have seen some efforts, but I agree. The international community needs to come together. There are supply, chain issues about the production of those medical supplies, and if we do develop a treatment, there will be issues of, how do we ramp up production of, the medicines, and how do we distribute, how do we make sure that enough gets produced, and how do we decide, how to distribute those supplies. If we do come up with a vaccine, how do we do that? Those are really important considerations. I agree the international community, under WHO, UN leadership, should be thinking about these issues. But I just want to say that just because I didn't mention them earlier, it doesn't mean that we're not deeply concerned about those human costs and these other issues. Just want to share that with you.
Anything to add? Okay. Next question. Go right ahead.
Okay, thank you for your sharing. There are lots of great insights, Alan. My name is Qivan Zhang from the second year Global MBA, also from China. So I would like to mention that this coronavirus happened to just at the Lunar New Year. This period of time is the traditional holiday, which is quite similar to the Christmas holiday in the US, while lots of people just transferring from different province to their hometown. So the Chinese government has already expanded this holiday to decrease the mobility of the population in order to prevent the disease spread out very quickly. But at this stage, people now are more thinking about they are now have to begin to go back to work, especially for the manufacturing industries. There is a huge impact on them. So my question is, on this stage, what do you think is important for the government or from the employer or even from the society side? What should we do on this stage? Yeah, thank you.
That's what is it, the year of the metal rat, the white rat now? It's supposed to start a whole new era, 12-year new epoch, so to say, and it started this way. So I don't know what we have to be fearing for the next 11 years, what's coming next. But in a way, it was a blessing and a curse that it happened at this time, right? Because school is out. People are not working. On the other hand, they're traveling to go home. So on the one hand, we don't have a lot of transmission in schools and workplaces. On the other hand, people do travel back and forth, and it's considered sacred to go back to your family and celebrate where you're from. There's a lot of transient workers in China. I think on your question and what they should do, I think it's important, again, to get back to this idea that because we don't know much, when humans have a problem with risk assessment, especially when it's low risks, like small risks, we may think something that's really small is much bigger than it is, and something that's bigger is actually smaller. So we have a problem with our brains processing risks. So in some parts of China, obviously in the epicenter, it makes no sense to go back to work because it's just going to transmit the rate of transmission, the rate of infection. There's 60 million people living in the province, and at this point about 70,000 of them are infected, so have been proven to be infected. So that's about 1 in 10,000, which is pretty high. So probably no. But there are some parts in China, like, Tibet has like 2 cases, and, down in the south where they have some pretty draconian measures, the province right across from Hong Kong, they have probably 40 cases in a province of like 100, 200 million people. So you have to take into consideration what is the actual probability that somebody will get this if they go, what is the prevalence of this in the population? And if it's less than 1 in 100,000, less than 1 in 200,000, then probably people should go back to work. And again, I want to draw the parallel with the regular flu. I mean, we go to work in flu season, right? Even though flu mortality is a little less than this, but it still affects people who die from the flu or have similar characteristics as people who die from coronavirus, and the transmission rate seems to be somewhat similar. So it's important not to overreact and sort of draw the line. There has to be some kind of guideline by the WHO or infectious disease specialists as to what prevalence is considered too much and what prevalence is considered just fine, and then you can go back. So I think that's what's going to be, it's going to be up to the Chinese government to decide that.
I think taking the personal measures will be more impactful as compared to all of the draconian measures that we're taking, putting huge population or quarantine and all of that. This disease is transmitted by droplets, either by coughing or by sneezing, and not more than even 6 feet from a part of people who are infected. And when you are infected, that's the only time you can transmit the disease. So people taking personal hygiene and sanitation, hand washing, making sure that if you are sick, the go to the facility on time. People are tracked. Those who are sick, their contacts are known. And so taking these very simple, high impact interventions in the population is beneficial as compared to panicking and getting in fear and creating more cases in the population. Though the transmission of Ebola and the coronavirus are not the same, for Ebola you have to have a physical touch of the person who's infected or their stool or vomiters and other things. It's different from the coronavirus, but yet the same measures apply to the public health measures of hand washing, making sure that you sneeze in your airborne and those things that you can do. So communication is very, very much important, but we get it wrong at the beginning of huge outbreak like this because they panic oversee the kind of measures that we're supposed to take to save the population. When it gets late, is when people get to realize that, okay, those are the simple things that we were supposed to do to stop this outbreak.
Thank you. Professor Sutcliffe.
Oh, okay. Great. Professor Sutcliffe right here. So my question really, I'd like you to take a step back, and you've been talking about the effects that you can see, but what might be some socio-political effects more broadly? Or will this just be, one other virus that goes away, and I'm not sure, anyway, I'd like to hear more on that.
I'm going to abstain from the political, but I will give you an example for some social long-term effects that are intertwined with the economic ones. There's a very interesting paper. It's called Loss at the Time of Cholera, and it's based on the cholera epidemic in London in 1854. And what they show is that 160 years after the epidemic, after there was an outbreak in just one neighborhood in London, and cholera is transmitted, it's a bacteria, so it's basically the water, and that's John Snow was the scientist who discovered that. They shut down the water, the epidemic finished and all that. But 160 years after this happened, rents in that area were lower, tenancy was shorter, poorer people were living in that part of town. So, and they showed that this started happening right after the epidemic and had effects for over 100 years. that this neighborhood in London that experienced the cholera outbreak was populated by people who were poor. There was higher occupancy rates, lower, higher turnover, and just in general, that was sort of a slum. It turned into a slum, and it continued to be. At this point, I don't believe so, because I was there last year, and it didn't look like it, but it was for a very long time. So I worry about the long-term consequences of, especially if these stigma and sort of these animal spirits continue for people from that province in China and in Wuhan in particular, and how that's going to affect. There isn't that much mobility in China as there is in London, but just in general, who settles there, what happens? I think we have to be careful, and the government's going to have to be careful in how they respond to this, because I think it's a natural human reaction to sort of avoid this, and then with economic and social consequences for the place that happened to experience the epidemic.
So going back to the dairy, product suppliers example from earlier. So if improving the quality of certain supply chains in the agribusiness sector, going from tens of thousands of very small 4 or 5 cows milk producers, to consolidate those into bigger milk producers that are easier sort of to monitor, and the supply chain becomes easier to monitor, and the quality becomes easier to control, and so on. That requires, that has consequences for the incomes of those small, cow, owners. And so, with political and social implications, that will require a sort of a big, a lot of thinking, a lot of thinking on the part of the Chinese government and broader society. So yes, I do agree that there are broader socio-political implications that we might not be able to immediately fully appreciate if, going forward, if we want to reduce the likelihood that similar, epidemics start in the future.
Hey, Talbert, can you talk more about how these disease outbreaks affect the developing countries more than the developed countries? And what do you think is the role of developed countries in helping these developing countries? Sorry, Mario, can you tell me more about how these powerful companies and organizations, what is their role in lobbying and pressurizing the governments of different countries to make unethical decisions, and it affects the lives of a lot of people, but since it's benefiting these companies and these lobbies, how does it affect the whole economy, and it destroys competition, like you have taught us, in economy, it destroys free competition and, destroys the economy. So are we trying to control it?
So let me take this last question first. So I'm not sure that it's a matter of, powerful corporations, or necessarily, I'm not saying that that doesn't happen, but necessarily mainly a matter of, powerful corporations lobbying and so in the dark and so on. It's sort of, some of it, like single sourcing, say, the issues with global supply chains is that it's convenient to have a single supplier from China, say, where, intermediate inputs are produced efficiently and cheaply, okay, and just in time, because it's more efficient to do that. So what I think is that, this episode might sort of induce entrepreneurs to sort of revisit their single sourcing decisions, and maybe diversify across regions within China, or across going beyond China. So the wisdom of single sourcing might be revised. So it's the at some point, it's the economics of it that, in part at least, causes this fragility in the system. I know I probably haven't really fully answered your question, but I just think that the issue is really broader than powerful companies lobbying for special treatment.
Thank you. And did you want to make a quick comment on developed and developing countries, Talbert?
Okay, thank you. I think that's a very important one. I was last week on another panel that I was looking at the Center for Global Development in Washington, and they were on a panel that was talking about is the world is prepared now for the coronavirus disease outbreak of 2019, and what the world is supposed to do, especially for the developing countries' perspective. Also, I'm part of a team of experts that look at the Global Health Security Index. And if you look at the Global Health Security Index report, you note that no country is prepared right now to deal with some of these outbreaks, especially at the gravity as we is looked. But developing countries are disproportionately at a disadvantage when it comes to dealing with these outbreaks. And some of the reasons are weak health systems, the economic is challenged. There are priorities that they're dealing with. Some of those countries to even pay salaries of their workers can be very difficult in developing countries. Having the kind of isolation facility for testing and all of that can be difficult. Those countries can deal with it, developing countries, if the outbreak is at a small scale. But if the magnitude is very huge, then it requires a lot of supplies and logistics to go in there. This is where high-income countries have to play a role. For example, the Ebola outbreak in West Africa cost the world about $53 billion. Who could afford that bill? Developed countries and high-income countries were those that were able to help. The United States government alone spent about $2.4 billion to foot some of the work that was done in West Africa and across the world with the Ebola outbreak. So developed countries have a role to play in that, and this is where the global health security agenda with the U.S. government play a critical role in health security and helping the rest of the world.
Thank you. If we keep the questions and answers short, we can get the final two questions in.
Thanks. My name's Jeff Hook. I'm teaching the finance department here at Carey. I wanted you to elaborate a little on the single sourcing idea. I mean, do you think any big companies like Nissan or Apple will actually move some factories out of China, go to Vietnam or India, or are they just going to say this is a one-time thing and we don't have to worry about it?
They might say just that, but I do wonder, whether that would be wise thing to do. I mean, if you think about the pharmaceutical sector, I mean, it's really you expose yourself to a lot of risk when 80% of your key components come from a single factory or a few factories from a single geographical area. Sure, this it might just be we got unlucky once, and the response by the Chinese government really has been really sort of strong to contain these, which indicates that any future incidents might be dealt with in a similar way. Which might induce, U.S. or European manufacturers to sort of think again that this is a one-time thing. But I do think that we need to be thinking about, whether bigger changes would be wise.
And Karen, you get the final question.
Great, thanks. Karen Sentimentus. My question was actually the flip side of Jeff's, in that I was going to ask the panel if you thought this was an opportunity for some to disrupt the supply chain, kind of enter into it in a way they would not have been able to otherwise.
Well, I think it depends on the industry. And in fact, to the question that was posed to Mario, if you read the reports on drug shortages happen exactly in these situations. And they can happen because of a factory that's in the US, in China, in Canada, anywhere. Like one thing happens, it doesn't have to be an epidemic, and then the drug just disappears. So it's very hard it takes months for a generic, for another company or plant to set up their process so that they can start producing this drug. And because of the intense competition, in particular in the generics, that means they have to give up on something else. So then you create a domino effect of other shortages. However, we have a fix for, like, at least there is a partial fix for it. The FDA is keeping track of all these shortages and trying to sort of negotiate with different companies to fill them. And that was under Bush Jr. Was the law that passed that tried to do this. We still have a lot of shortages, but at least there's something in place that's trying to address that. Now, if it's widgets, or I don't know, if for those of you who have kids, like Beyblades or whatever, the things that kids play with, maybe somebody in Louisiana can do it. I mean, you know, my dad in Bulgaria can bake it. I don't know how he's going to get it to the American market, but it's no biggie. But things like car parts and cell phone parts and pharmaceuticals, I doubt it.
Well, thank you. I want to thank everyone for attending. And this has been a very informative session. I'm sure this discussion could go on for many more hours and not just the 1 hour. On Wednesday afternoon, we will be hosting a discussion here as well at 4:30, more on the health aspects rather than the business aspects. So I invite everyone to either come back or look for ways to stream it online on Wednesday afternoon as well. And I want you to join me in thanking Tolbert, Mario, and Emilia for their insights this afternoon.